just to say, it's just really great to be here, and wouldn't it be lovely if we were standing in a venue somewhere now, the whole room full of social workers, because we like nothing better than to be in the company of social workers. And so it's really good to be here, and I'm going to kind of try and throughout this picture and imagine, I think there's 84 of you on the line at the moment. I know we're expecting more, but I'm going to try and imagine you all sort of sitting there and enjoying the session, but also hopefully interacting with us throughout. Now that's going to be quite a feat, because we know that when we've got this many people and we're on Teams, it's not quite the same as people putting their hands up. But we have got a couple of things we're going to ask you throughout our presentation. We're going to show some videos and films as well, and we're going to ask you to interact as much as you can. And don't worry if you make the chat box explode, because we'd really like to hear from all of you when we pose some questions later on throughout the presentation.
Brilliant. Right, so I'm hoping the technology is working and you can all see our presentation. So if someone could nod, that would be good, and then I know we're good to go. Yep, fantastic, brilliant. Right, so first of all, I am just going to do that. So just to introduce ourselves in the first instance. So Fran and I, when we present, we're quite keen to try and do things a bit more engaged and conversationally as well. So I'm going to introduce you to Fran. So Fran obviously is one half of the Chief Social Workers of England and has been in that post for about 18 months now, and leads at the Department of Health and Social Care as the Chief Social Worker. Fran also has another job in the other part of the week, although these jobs collide quite a lot, the long days. But Fran is also the Principal Social Worker and Strategic Lead at Thurrock Council. And she has particular responsibility for operational delivery of Thurrock adult social care services on a day-to-day basis. And if you don't know Fran, Fran has a couple of areas where her practice and her expertise and where she really drives some of the work she does in terms of social worker, very much centres around the engagement of community-led social work, community-based practice and cohesion, but also in adult safeguarding, modern slavery, and she leads on the Prevent agenda, both for her local authority, but has also been very leading in terms of adult safeguarding in the Department of Health and Social Care, and some of the work we've been doing this year and some of the work you'll be seeing next year, which we might talk a little bit about more at the end. So that's Fran.
Okay, and now let me introduce Mark to you. So for those of you that don't know Mark, he is the other half of the Chief Social Worker at the Department of Health and Social Care, and has been with us. We've both been doing this role now for the last 18 months. And Mark is also Operations Director for Adult Disability Services at Hertfordshire County Council, a real champion of human rights, a real champion of social justice, and his particular expertise is around learning disabilities and autism. Mark's worked in adult social care now for over 30 years. So between us, I think we bring 60 years experience to the role, and started off as a care assistant in a learning disability residential unit, and he's now of course Director of Services, but still really holds that real passion and keen interest in the rights of those people with learning disabilities.
Brilliant. Thank you, Fran. So welcome to our talk. So we've split the talk into the title in two. We're going to start with a bit of a conversation about leadership, actually, and what we think it means, both to us as Chief Social Workers, but also what leadership can bring positively, and some of the negative connotations about the industry of leadership and what it means. But we thought we'd start by just having a quick look at what the PCF tells us about leadership in a social care setting.
Okay, so for those of you that are really keen on your PCF, it's in domain 9, and it's professional leadership, and it says promote the professional and good social work practice, take responsibility for the professional learning and development of others and the development of personal influence, and be part of the collective leadership and impact of the profession. So just putting it in that kind of foundation of your PCF, that this whole session, if you like, will add to your CPD around that domain 9, and puts it in that context for you.
Brilliant, thank you. As you kind of see from that definition of leadership through the capabilities framework, which Baz will lead for us, it's very all-encompassing. It can be applied wherever we work in our systems, whether we are chief social workers, whether we are operational social workers every day, whether we're training social workers and students, that actually we can apply some of that thinking to our day-to-day practice and day-to-day roles in our local authorities. But one of the things we did want to talk to today was really taking a slightly different approach and talking about possibly some of the issues around the term leadership and what it means in our sector and many public sector elements, which we call the elephant in the room. And Fran and I have had lots of conversations about one of the real risks about the concept of leadership is that one, it can be overused, it can become a catch-all word which ultimately doesn't mean anything but can be used. It's quite often a consultancy fee. If you buy in some leadership training, everything will be fine and everyone will be leaders. But also it's one of those terms that can be weaponized to a certain system. It can be, actually, if you're not a leader, then you're not with us. It's a critique for what you do. And quite often, some of those conversations don't come with the narrative of what we actually think real leadership is. So you will very often hear the phrase in the public sector, everyone's a leader. Now that may be okay, but unless you're having a conversation about what that actually means, what you potentially are doing is setting people up to fail, or you're all using the same term, or we're all using the same term and meaning something completely different, which means ultimately we can miss the point of the concept of leadership and what it means. And some of the areas where we feel that that's worth exploration, the conversations that we have on a day-to-day basis, is that growth, that concept that everybody is a leader. Loses the principle of what leadership might actually mean on a day-to-day basis. There is a big industry that sits behind this, the idea that you can buy lots of training and make everyone a leader. But actually, if you have been through leadership courses like I have over a couple of decades, there is a fashion element to this. So you might go to one leadership course and then a few years later, the fashion changes and you go to a different type of leadership course. And actually, again, for us, that may undermine the principle of what actual true leadership is and what it might mean beneficially for us as a profession and as social workers, but also what it means for the way we work and support people in our communities on a day-to-day basis. There is also something else about leadership being based on a lack of evidence, that quite often good leaders are ones that come up with good ideas that everyone likes, again, that trendy element to it, but not necessarily based on hard-fought evidence, good research, and actually what we should be applying. So you can get a really transactional approach sometimes to leadership in social care, where people are trying to fix stuff very quickly. And I know we will have all experienced that. Sometimes it's great and sometimes it works, sometimes it doesn't, but at what cost, it's sometimes unclear. But again, you get that narrative potentially sometimes that unless you buy into the idea and lead it, you're not part of the journey, you're not part of that conversation. One of the other things that we've kind of noticed over recent years is we use the word there, probably comes clumsily, but the corporatization of radical into managerialism. And what we mean by that is there has been a growth, and many of you will have seen this idea that to be radical, to be different, is to be the same to a certain extent. So we see organisations and companies setting up the radical group or the school of radical approaches, the school of radical leadership. But to a certain extent, radical and that internal corporate management of what radical is are two very different things. And I think what we want to talk a little bit about today as we go forward is that actually radical can work in a leadership space as long as you fully understand and imply what leadership means and that you are truly being radical, but using some of those concepts of evidence, of change, and doing things for the right reasons. We also wanted to kind of reflect a little bit on leading what and who. If everyone's a leader, who are we all leading and what are we leading for? And how does that play out in our day-to-day work? And ultimately, what's the difference between that and our professional leadership? As social workers, our responsibilities is set out in the PCF to lead our profession, as well as lead within the organisations and the roles that we have on a day-to-day basis. So I think we just wanted to start with that conversation that sometimes the term leadership is as problematic and misused as it is as possibly being positive. And what we want to do really is explore what we think the approach is, what the positives are, and actually what modelling of good leadership might look like. We want to do that hopefully in a slightly radical way, and we're hoping the next video is probably not one you'd expect from us, but I think well, certainly epitomises some of the leadership qualities that Fran and I would like to be able to have actually, but also respect on a day-to-day basis. So we're just going to move on over to a video. Fran, is there anything you wanted to add to that, or?
No, the only thing I would add about leadership courses is that, for all those people who've done a leadership course or are thinking of going on a leadership course and clearly do them. I mean, we're not saying don't do them.
Absolutely.
What we're saying is do them, but don't. I always say don't let a leadership model don't try and fit into a leadership model, let it fit into you. So take the bits of it that you really want to use without having to try and feel like you've got to fit into a certain style. And I think that makes you a much more agile leader. So do the course. We're not saying don't do the courses, because that you know, they can be great and they can be fantastic learning. We're just saying just always just keep an open mind and look at other different methods and different ways of working. And like I say, try and be as agile as you can with when people will say to you things like, what do you think your leadership style is? And often leading into these courses, there'll be things like psychometric testing and like little tests to say where you kind of fit. They're all really interesting and really good, but just be mindful that you can't always fit people into those little boxes, and that we can all be very agile in the way we work in terms of our leadership.
And I think probably just to add on that before we get into the video, the other bit that we didn't mention there, and to build on what Fran was saying, is that remember that as social workers, what you bring is the knowledge of your profession as well, which absolutely can impact on some of those either leadership courses or your role as leadership. So quite often when you are involved in these conversations, everyone will talk about system leadership. I think what we would urge you to do is bring to that systemic leadership, understanding of systemic theory and how that applies, not just in organisations, but across organisations and the impact on individuals. Because actually, I think quite often the word gets muddled in a managerial approach, but actually systemic thinking is hugely important in leadership and working across systems, and trumps those kind of system ideologies that can quite often be present. So bring that to the learning and help shape those courses as well as contribute to them. So we're going to introduce you to our friendly general now. So we're hoping you've all got your volume turned up and that the IT holds out for us. Right. So I think from the look at the chat, I suspect 50% heard it and 50% didn't, and some was somewhere in the middle. So for those that did hear it, we'll carry on. For those that didn't hear it, I will pin a link to my Twitter account to the video. So that you can have a look a little bit later. I suppose what I'm going to do is I'm just going to start by giving a little bit of background and then hand over to Fran on this. So for those that weren't able to see it, this was an Australian Army general giving a speech, I suppose, a leadership speech on his view about an incident that happened within the army. And the incident, to a certain extent, is probably not the key element, although I think it is very linked to what we do as social workers. But it's the way he does that and the way he has that conversation. And I've quite often joked that I have been on leadership courses, been some amazing ones, but I've also been on some where tens of thousands of pounds have been spent by organisations, and I could have just watched that video for 3 minutes and learnt more. So Fran, what did you think about that video? What's the key bits for you?
So I saw that video. First time I saw that video was when you shared it with me a little while ago, and so hugely powerful. And I think some of the people were saying comments in the box like, "Wow!" Especially when he says, you know, if you're not going to fit in with our standards and you don't want to be inclusive, then you can just get out. And the other thing I didn't realise about the video is that's not acting. That's not somebody doing a script. That is actually the real person doing the talk. Talk to the people, you know, of the Australian Army. So it's incredibly powerful, and what I think it represents is the values that we hold. It also the tolerance, that sort of assertiveness, the way he's doing it. And we talked, didn't we, Mark, about when you're delivering a message that is that powerful, how you have that charisma. And charisma isn't all about, you know, looking great with gleamy smiles. You know, charisma is about having a presence. And I'm really sorry some of you couldn't see that. I don't know what happened. It was working fine for us, but this particular video, if we put it up in a, you know, if we can send out the link to you, you'll be able to watch it in your own time. But this person has a real presence. Without having to be the gleamy charisma type that we might think, or moving around too much. Actually, he has a real stillness about him, but the message he delivers is really a zero tolerance one to, you know, to what was on this example was degrading of the female officers by other male officers. So absolutely great example, I think. And I think Mark's right. If you kind of think about it, you want to see a good example of a message and a bit of leadership, that is a really powerful video, we think, to watch. And kind of, I think, although it's a different area of work, it's very much in line with our values.
Yeah, absolutely. And as he talks through his talk, he uses terminology like the values of their organisation, the culture the commitment, the expectation, but also the reward, the fact that you are part of our, he talks about being a band of brothers and sisters, that actually there is a collective family there, that there is leadership, yes, but there is also a cohesiveness about that support and arrangement. And I think that's, for me, one of the powerful things about that video as well, is that every time I see it, one, I think it's quite emotional, but two, it's incredibly positive. And I'm not a soldier, I've never been anywhere near the army, but I would follow him. And just those 3 minutes, I would trust what he said, and I would be able to understand what my role was in that, and how I could make a greater good based on the information that he was sharing. So we think leadership is really important, despite our earlier things but it's about owning the leadership and really being clear about what it means. And this next slide really, we hope, sorry, Fran, go on.
I just wanted to pick up on a remark that Susie's made in the chat box, and that's one of the most powerful lines to me. And I was going to say it, but I've just seen she said it. Is that message that what you walk past is what you accept, is a
Yeah.
really, really powerful message, and I'm going to remember that, and I'm going to quote that in future, because I think that's incredibly powerful and very apt for a lot of the work we do.
Yeah, absolutely. And yeah, I mean, you're so right, isn't it? I think he talks about the standard you walk past, but you can adapt that, can't you? The care you walk past, the behaviour you walk past, that is what you accept. And for me, that is that truer meaning, that link of where people talk about everyone's a leader. I think that gets lost, but I think those sorts of concepts are that we lead the world around us and what we're in and our professional roles and expectations. So we've got a slide here where we think, if I can get it to work. Oh, is this one really. This actually is from Forbes, which is a big American company, but they talk about the essential qualities that define leadership. And Fran and I were looking at these for a number of talks and bits we've done, and we actually thought, in terms of our general, he does reflect a lot of this. That actually a lot of what we need in our people that help us and help lead, or where we might lead collectively, are some of these characteristics that define what we do. And we talk about enthusiasm, about integrity, which we thought, that whole 3 minutes of that general was pure integrity all the way through. Being able to communicate. And communication has to be the right communication style at the right time. And as Fran quite clearly said, a very assertive, charismatic, stern, still level of communication was absolutely the right way of communicating in that scenario. But we also like the idea of loyalty, didn't we, Fran? About that. And what we don't mean loyalty is just, that covering everyone's back. That's not loyalty. Loyalty is about being part of the support, the groups that you work with, being dedicated, being loyal to their thoughts, their ideas and thinking, and supporting them. Being able to say, yes, I might be, the chief social worker, but I didn't do that. I'm loyal to my team. They did that. They brought that around, and sharing some of those elements. And then obviously some of those wider bits there about decisiveness, being clear, your communications and being decisive about them, so people are very clear and understand where they're from. Managerial competence, I mean, that's again a clarity, but being clear, being competent in what you do, and being supportive, because what people need is you to be competent to help them do their jobs. And I remember I've had managers in the past where I've said, I need you to be a good manager and do what you do well, because that helps me do what I do well. I don't need you to be in and out of everything else and being vague and clear. And then empowering, and lastly, charisma, which we thought was an odd one, but we did talk a lot about that, didn't we, Fran? The charisma in a leadership list, but I think we've grown more fond of that as an idea. As long as you realise that charisma is, as Fran said, it's not about being liked, it's not about being the fun one. It's much more important to that and how you engage with people across the board. Anything you want to add on those lists, Fran?
Well, yeah, I mean, just to say, Andrew McCullough has just put up a thing about, well, what about vision? And that's right. I mean, of course, vision, I think in that example as well, for those of you that managed to see it, there is a real vision in that, in what he's saying, but not explicitly. It's just there, isn't it? So I think, although these are the Forbes 8 tips, of course, we would always say that somebody who presents a vision is always somebody that defines a really great quality in leadership. But that can kind of it's a kind of quite an abstract concept vision, but it's certainly looking at that video, and if those of you who didn't see it get a chance to look at it, I think you'll see that this man, without even mentioning what that vision is, you just get a sense that there's a vision for how he wants things to work.
Yeah, absolutely. Right, we're going to play you another video now. Now, I do need to just add a slight contextual warning. This is an American TED Talk video, and there is actually a bit of terminology in here that we probably wouldn't use in this country, but is used to mean something different in this story. It's referring to a party animal being a party nut, you know, being a bit of a nut and getting out there and raving and dancing and stuff along those lines. So contextually, it probably doesn't land too well in terms of what we would do, but we thought the message in the video is quite useful in terms of leadership context. I suspect many of you may have seen this video as well, but we'd quite like to show it to then maybe have some conversations after about what it means. If you can't hear the video, again, I apologise. We will put it up on our Twitter accounts later, so that everyone can be seen. So I think what we wanted to do with that one is take that conversation a bit further. That idea that leadership in itself is not the thing that makes things happen. This idea of movements is really important, and that actually that idea that one person may be doing a silly dance, probably had no intention that there would be 30 or 40, 50 people coming around him, that actually the person who takes the risk is the person that gets involved with that vision, and then attracts others to it as being a really important item. Fran, did you have any thoughts on that?
No, I just very conscious that there's still some people saying that they didn't get to see the video. So basically, it was a video of somebody, kind of a festival setting, who was kind of dancing quite wildly, and he's dancing on his own, and then one other person joins him, and then eventually you've got a whole crowd joining him, and there's a talk about how he's the leader and how the other people that are coming in are also adding a leadership quality, because then other people lead with it, go with them as well. So it's difficult without seeing it to really describe it, but obviously as we're talking about it, it's just kind of a really kind of good visual illustration really about that kind of concept that some of the most powerful people isn't the leader itself, it's the other people that then kind of come alongside that leader and then bring their friends along as well. And then it talks about in the end it becoming a whole movement. So that's just for those people that didn't see it. But yes, I mean, again, I just think it's just a really good illustration of how, you know, we can see leadership in a slightly different way than we would traditionally would. So I think for that sake, it's very powerful.
Yeah, I agree. And again, I think it's a better example of that overused word about everyone's a leader, that actually everyone has a responsibility, I think, to certainly in social work and social care, to do the right thing and come up with the right ideas, and that hopefully some of that thinking, that idea of movements, is as powerful. There might be leaders within it, they may be operating at all levels within that movement, but that is where you pick up on the idea of vision that was picked up earlier for me, is that one person enjoying a very strange dance didn't necessarily just bring the vision. The others that came along took that vision and extended it, and they made it a thing. And that's that extended leadership, which we think is quite important in social work and social care.
Yeah, and Janine McLaughlin says all it takes is one brave idea or one act. And I think that video really illustrates that really well.
Yeah, absolutely. Right, so we would quite like to, as much as possible, and it's great, I can't see the chat box because I'm doing the presenting, but I hear it beeping a lot. So there's lots of you either saying we're rubbish or getting engaged in the conversation, which is really good. So we'd quite like to pose these two questions. So we just want you to pose the first question and take a minute or two where you can just pop your answers into the box, and colleagues at Social Work England are going to pick a few to feed back to us. But I think the first thing we want to talk about, we get into the details of the power of social work, is to understand from you all, why did you become a social worker in the first place? So feel free to throw a few words in.
And I will read them out, Mark, for you and Fran. Absolutely no problem. Looking forward to see why people become social workers.
This is where it goes all quiet, isn't it?
Yes.
That's because they're typing.
This is true.
Right.
There you go.
Yeah. We have to help others, tackle injustice, voice the other voiceless. Love that. And basically to help people. I want to be part of change, and I wanted to see in the world around me, to support others, change, to challenge social injustice and influence change, be part of revolution. I'm looking forward to enable others to change their lives and support them with that. And thank you, everybody. I get lots of comments in the chat now. Combination of early social responsibility and the realization I was quite persuasive. Because young people I work with, and as a youth worker, experience such an inconsistent. Sorry, I have too many messages in the box. I was inspired seeing the positive impact of home care workers, informed carers. I want to make a difference. That's great. I will always love to help and support others, and also to empower people to own change, to inspire, protect children, support and help families. It's really amazing. Thank you for all of your contribution in the chat. And I'm sorry if I don't manage to read all of them. Positive change to the vulnerable people. Mark, tell me when I should stop.
Well, I think hold that thought there, because we'll have some more. We'll do the next question in a minute. I suppose I might be launching this unfairly, but Fran, why did you become a social worker? Oh, you're on mute, Fran.
Help if I'm mute. It's because all these pingings are coming up. I was going, it might be driving people mad with all this pinging noise coming up. It's fantastic to see what everybody said. So I became a social worker, and I've talked about this a lot publicly. I think it was born out when I was very early, and some of the messages that my mum gave me when I saw her supporting a woman. This is back in the 70s. I saw my mum supporting a woman in the community who had schizophrenia, who then people understood very little about schizophrenia. And I think that's where it was born, because there was that idea that I wanted to really make a difference to people's lives, and people who were, she was what I would describe at the time, my words at the time was she was bullied by people in the community. And at the time I've had some bullying in my life, and I kind of made that connection and thought, you know, whatever I do when I'm older, it's got to make a difference to people like her. And that sort of social injustice thing was born in me, I think. What about you, Mark?
So I think probably a very similar thing. I grew up in a very political household, so I saw the concepts of kind of social justice being a really important thing. And my family used to, actually, a similar story, Fran. My family, I remember once someone that my dad knew loosely had become very unwell, psychotically unwell, and rather than letting him be admitted to a psychiatric unit, he offered them to come and live with us. And from that, I think I kind of learned about that kind of idea of inclusiveness. If I'm really honest, the idea of training to be a social worker, I don't think I really knew what a social worker did at that point. I just had this kind of idea that it was political and it was about making a difference and tackling social injustice. So I probably went in naively, but I'm pleased to say it kind of, for me, it was the right thing to do as well going forward.
Mark, sorry to, I just want to add the last few contributions in the chat. Probably Fran have seen it, probably is really important. From Sue, support to build resilience and recognize own strengths to manage the issue which are preventing them function. And another one, the translation of hope and aspiration to reality. And back to you, Mark and Fran. Thank you.
Brilliant. Thanks, Anna. Look, what we'll do is let's spend a quick minute if people want to throw some few ideas in here, because quite often why we came into social work and the power of what social work can do, what difference it makes, can sometimes be a bit different. So you're in social work, you've come in, you've trained. What key differences do you think you can make on a day-to-day basis in a positive sense?
We already have some comments in the chat.
Brilliant.
So develop and offer hope and opportunities to develop ways to regain and retain control for the individual. For another answer to the second question, to educate others and break down barriers.
Fantastic.
The best leaders I have come across are those without a massive ego. I love that one. Nimal, thank you for that. Social work can inspire others, bring hope, challenge discrimination and inequality, promote people's rights, give hope to people, empower people to have control of their lives, to be a bridge in helping people identity and reach their goals.
Brilliant.
It was just amazing to see all of these powerful messages. Ensure that people's rights are upheld. No decision about them without them.
Yeah.
So I think what's really nice about this is that I think, and it works quite well for me, Frank, because it leads us well into the next section, which we will go into now, is that the really important thing about social work is it's not specific to one thing. It's about people, communities, relationships. We don't specialise in, one bit. Social work of the foot. We specialise in humans and what we do on a day-to-day basis. So I'm going to hand over to Fran just to take us through this one.
Yeah, and just before we get on to this next slide about, your kind of reach, if you like, into various different areas. I'm sorry about that constant pinging in the background. Is just one of the reasons why we've done that is for you to say out loud why you came into social work and say out loud about the difference it makes. It's because, we just need to sometimes just have that moment to kind of think, actually, if you just read some of those things and if you just realize why you came into the first things, it's the thing that helps you gain your resilience and keep going. And what's been, we know it's been one of the most difficult years. It's probably going to be the most difficult year you've probably had in your working lives because of the pandemic and because we've had to do things differently. But it's just about just thinking about, well, why did I come into this in the first place? And there's another question we could ask, but it would just be more and more pinging, which is, well, what have you done this week to make a difference? What have you done this week to do whatever it is that you wanted to come into social work for? So again, it's just a really good thing to kind of just say out loud, hear what everybody's saying. That's why it's great to be in a big room full of social workers. It can be quite inspiring in itself. So this next slide is talking. This is just a very busy slide, and when I've done this one, we've shared this one at many different forums, and people always say, well, where's safeguarding? And I will change it one day and put safeguarding wrapping all around the whole thing. So just take that as read, that safeguarding wraps around all of this. But this is just an illustration of, if anybody ever says to you, what exactly does social workers do, then, just share with them this slide and talk it through with them, because our reach is really, really wide and it's very different from other professions because we're in the business of human beings and relationships and, people. We sometimes struggle to find the words. So I mean, this is just a really good illustration, I think, of the fact that we're working throughout local authorities, but we're also working throughout her health settings as well. So there's all that hospital focused type social work. There's all that local authority provision. In that column there on the left is just all the various different areas that we work in. There is the whole social work in a whole range of different settings, so like hospices, palliative care, the primary care, all of those kind of different things that we reach into. Then there's all the third sector services. I mean, a lot of our social, we've got something like nearly 100,000 registered social workers, is it now? Iona will correct me if I'm wrong.
96,600, around that.
96,600 registered social workers, and we only count about 50,000 of those working in children and adults. And what we know is there's still another 50,000 out there registered somewhere that are probably working in one of these different areas that we're just not counting at the moment. It's always one of my bugbears that we really need to know where the reach is of all these different social workers. Some will be in academia, for example, which isn't on this slide, but again, it filters through to what we learn as well. So there's all those third sector services, and then of course there's the very important role in mental health as well, and our role as AMPs, up and down the country, our role as an AMPs in those mental health partnerships. And then they're just across the bottom, and that bottom section, it just looks at the careers and the workforce, the NHS long-term plan, how we infiltrate all of those kind of different areas of practice information and resource, and that setting standards, leadership and regulation. So it's a busy slide, but it's a really good illustration of the really wide reach of social work. And it's a really important one to remember and to share with people, because we were saying earlier on, Mark and I were discussing this before we came onto this session, and we were saying that how important it is to just remember that we need to sometimes, again, really celebrate the fact that we have that breadth and depth, because some people will have one particular role. So if you're a radiographer in a health setting, you'll be a radiographer in a health setting. I'm sure there'll be various different reaches within that setting, but it's not as vast as what you do. And it's a real kind of, be massively proud that what you do and the skills you have could literally go and reach into many, many different sectors and different areas that are on that slide.
Absolutely. I remember once a social worker, we were talking about the role of social work and what's different between social work and a nurse in one specialism, or a doctor or a housing officer, etc. And it was really interesting because when we got to the end of the conversation, the social worker kind of said, so what we're saying is all of those people are a part of the jigsaw, but social work is the jigsaw. And actually, I thought that was quite a nice analogy, is that quite often you're getting all of this stuff together alongside the person, not to the person, not over the person, but alongside them, in a way that makes sure they get access to this, it's the right outcomes for them, and they make sure it all really fits. And that makes our profession so vast and so wide. And whilst although we will have individual specialisms with what we do or the practice areas that we like, that doesn't mean we don't have a professional role and remit much wider than just the area where we work or the skill set that we prefer to specialise in. So we just wanted to quickly just go through last couple of slides before again hopefully we can have a bit of a conversation. Is really so what is the point? What is the benefit of a social work perspective, and what is the power of social work that it brings to situations, either to individuals, to families, to communities, whatever the circumstance might be. And so we thought quite long and hard about this, and we kind of came up with some of these. This is not all exhausting. And the next slide, we've got some examples that we'll go through. But the idea of the social model, I know the social model is more than just the social model, obviously, but being rights-based in what we do, ensuring that care and support is actually more than just care and support. I did notice there was a chat, I had a quick look in a minute, someone talking about quite often we need to remember that social workers are the intervention first and foremost, not just the prescribers of care packages. And that's really important that we hold on to that, because quite often, unless we take that intervention thinking and that analysis and professional approach that we bring, we can just buy care packages for people. And it probably will keep them safe, and it might give them an element of quality of life. If we truly want to be adult social workers, we need to look beyond that. We need to look at the work we do with someone. How does it enable them to be a citizen in their right and what they do? And then whatever we set up to enable citizenship will be the right thing. Because you can buy care, you can prescribe care, and it still won't enable someone to be a citizen. So think beyond some of that, and that's a really key bit we think social work brings. Clearly, we have unique capabilities. We are probably one of the only sociologically driven parts of the health and care system, and therefore that makes the kind of remit and role we have very, very important. We're expert in relational approaches. We are really good at understanding and working with complexity in all of its sense, and more importantly, holding and enabling that risk, being safe with complexity and risk, but working with it in a way that's a positive. Not just running to remove risk because it worries you as a professional. We don't tend to do that. We make sure we work alongside it, and that what we do is the right thing. We enable positive risk first and foremost, which is really good. I like to think we're all pretty emotionally literate. We bring practical support, we bring emotional support and understanding, and emotional intelligence, which I think is really important for whatever field of social work practice we're in, is key. It's got to be an underpinning element of what we do. But alongside that, we are a evidence-based, academically driven, knowledge-based profession, and we need to remember that. We need to use that knowledge, need to use the underpinning evidence that is our profession, and apply that to our conversations, not just individually with people, but going back to that point of leadership with our leadership teams, with our structures, with our councils, with our voluntary organisation, or the charities that we work with. Bringing that social work element is so vital. And quite often, a lot of you will be working in systems where there isn't a senior social worker, or your director isn't a social worker, etc. Well, many directors I know that aren't social workers, they are absolutely welcoming of social workers bringing that perspective to them. It gives them additional abilities to do the right thing for people and for organisations and communities.
And if I can just pick up with something that Janine's just said in the chat box, which is just, I wish I'd said it. She said it's important as we move towards integrated care partnerships that we as a professional keep our identity. And Mark and I are saying this all the time to the principal social workers as well. And educate others about our profession and the skill sets we offer. And then she puts, like Liam Neeson in the film Taken, us social workers have a specialist set of skills. Which I think is another quote I'm going to use, and I think that's really great. Thanks so much for that.
I wonder how many people joined this leadership course thinking they were going to see an Australian general and talk about Liam Neeson.
Exactly. Okay, so this next slide, I mean, we're just going to talk through it together, really. It'll be familiar to all you social workers, but social work, we think, is, it's more important than ever, and so we really must do it properly. On that previous slide, there was like this perfect kind of model, isn't there, of what a social worker should do. We don't expect that every single social worker is going to have all those skills. We're flawed human beings like everybody else, and we're going to get things wrong. And also, there are going to be some things we're better at than other things, and so really kind of harness those particular skills. But social work, we do believe, is really important we've got an opportunity at the moment, because we're all talking about it more. We're certainly all talking about adult social care and social care generally more than we have done, before. And there's just something about us being able to really step up at the moment and make sure those people around us and our peers are hearing those messages too, for us to really kind of really sell our profession at the moment. We talked about that, bringing the emotional literacy to every element of a practice. There is that default position for complex and emotional situations that's not directed by state and control. It's about freedom, choice and personal aspiration. We think that's really, really important. And then we've already talked about legal literacy is at the heart of social work, and rights-based practice and civil liberties are enshrined in law for that reason. Carry on the drive forward, the long tradition of social work as a risk enabler. And again, really, really important is that we continue to allow people and challenge where people are being so risk adverse that we are trying to put so much cotton wool around people that we don't allow people to live good, healthy, lives, being able to take their own risks. There's a real balance in that, and we're seeing that more and more, especially after coming out of COVID. Those conversations I'm sure you're having locally at the moment about that taking risks in that kind of really measured way. But just remember, we're there to walk alongside people. We're not there to fix people, and we're certainly not there to try and tell people how to behave. We can only walk alongside people, and if people want to take risks, we just have to kind of walk alongside them, point out maybe what those risks might end up with, but we can't just try and stop everybody from doing that. Then there's that whole influencing and leading good practice, and we've just talked generally about leadership and that kind of wider role. But we really think that social work has a key role in understanding and leading beyond the system and shape and work within it. When you get a group of professionals together, assign a senior leadership team, I always think it is the social worker that brings the person into the room. We could be talking about all sorts of concepts, all sorts of strategies. You can be sitting in a meeting that you could walk out and just think to yourself, my goodness, there's a single person been mentioned. We say it to our teams, and we also say it to our CSW team as well, that when you're in a meeting, just think to yourself, is the person that we're trying to support here in this room, have they become visible in language? And that's what I think social work can really bring, and we should still really strive to do that and question ourselves and say, okay, just come out of a strategic meeting, actually, when was a person mentioned, or when did we get a sense of that individual that needs that care and support in that room? And then just embrace what it means to be a social worker. Be massively positive, progressive and creative and proud.
Thanks, Fran. So that is us. We did want to specifically try and leave a little bit of time for questions on this kind of agenda, leadership, the power of social work, or just your thoughts and views as well. So I'm assuming we'll do that over the chat, or whether individually people can be brought on speaker to ask a question. That would be okay as well.
Yes, both ways. And I will say, I'll encourage, because we still have at least 5 minutes. If people want to have a proper conversation, like you said, Mark and Fran, maybe can put the camera on. If they want to raise their hand as well, it would be easier.
I'm going to stop sharing the presentation if that's okay, so I can see people.
Perfect, thank you. If anybody wants to ask directly questions to Fran and have conversation, please your camera on and switch off your microphone. Switch on your microphone if it's off already, and please contribute. I must say, some of the messages, they are so powerful in the chat, or all of them, in fact. Do we have any brave people? We have Christine. Christine, would you like to ask a question? I'm going to... Christine? Would you like to ask a question?
No, it doesn't look like it.
Okay, that's fine. Okay. For anybody else, if you want to ask questions, you can also use the chat area.
We're getting off lightly, Fran.
Well, can I pick up something that Moira Wood has just put into the chat box, which she says it concerns her that the increasing emphasis on practice and delivery is being driven by data performance. Yes, it concerns us too. We advocate for strength-based practice and promote relationship-based social work, but we still have pressures throughout of the work. So, you know, let's challenge what we're counting. We're doing that at DHSC level, and we're doing it in our organisations. Let's challenge what it is we're counting. People will always want that kind of hardcore kind of, you know, data that's really sort of quantitative rather than qualitative. And I think what we've got to bring to the table is that kind of, you know, why are we counting that, and why does that make a difference to anybody, and what does that really actually tell us? If X amount of assessments have been done in X amount of days, great, but what does it tell us about the quality of that assessment and the quality of the service that the person got at the end of it? It tells you very little. So there's no magic answer to that, and you're quite right, Moira, but we just have to keep being up there in those meetings and challenging. If you're a social worker that isn't in the you know, you're a social worker out practicing and you're not in those strategic meetings, you can still do your bit by feeding that back. You can still do your bit every day by kind of talking about the stories and the good outcomes that people have, and making sure that they're filtered back up as well. So it's not just about, you know, facts, figures and numbers.
Yeah, and I would just add to that as well. We all have that accountability and responsibility to shape that data and the right data. So it's very easy, and I'm not suggesting anyone on this course does, but I've gone around the country with Fran, and there's bits where people say, oh, they just make us do this and count. But come up with a solution. Don't just come up with a critique. You know, we can give a very strong message as a profession. And actually, as we've known in the past, in my experience of being a social worker, is actually we also answer some of the questions that big organisations need, like doing things more efficiently. Well, social work and being the intervention is a much more efficient approach than buying a load of stuff that doesn't necessarily work for people. So, you know, you have an answer as well. So join in the debate and the conversation and shape the data.
Yeah, and it's important for us to give the message that, you know, as social workers, we do challenge, you know, and we can be quite radical. We can have a really quite a powerful voice, but we must do that in a really constructive way always. So if you're feeling quite critical of your management, or if you're feeling quite critical of something that's happening in government or whatever, it's very easy on the sidelines to shout about it without actually thinking that you can kind of get alongside people and change people's views. So we would always say that critique away, but always critique with a solution in mind. So it's so much more helpful to people, and it will be so much more engaging to our partners and our peers in any conversations that we have. Otherwise, it can just become like a bit of a kind of a, you know, you can kind of create a bit of a them and us, and that's not really healthy for the profession. So I really think get alongside people and you know, try and change their view, as opposed to thinking, you know, I'm just going to complain about that and it doesn't make any sense. Of course, there's going to be times we're going to feel a little bit jaded, but you've just got to have that resilience and that energy to keep going.
Thank you so much, Mark and Fran. I was really, really excited to have you today in this workshop for the Social Work Week, and I can see lots of comments, and I think it's been energizing for everybody in this workshop to hear your interesting insight. Thank you once again for your really powerful presentation. And I just want to make sure that the people who are still in the session, that this recording is going to be available on after the Social Work Week on our YouTube channel, at Social Work England, and we are happy to communicate with you by emails and so on if you can't find that channel. And I think my colleague Andrew and Matthew have added already in the chat where you can find that information. I also encourage those of you who are social workers. I can see a hand raised there. I'll come back to you. 1 second. Janine, yes, feel free to put the camera on if you want, or just ask a question. Janine, feel free. Lovely to see you, Janine.
Hi. I just wanted to comment on some of the things that we've been talking about identity, and I think I found this session quite inspiring in terms of getting the social worker identity back. I mean, where are the days gone where as social workers we were an intervention? the care management, yes, it's give us a role in certain teams, but in some ways I feel we've lost our identity to a process care management driven system, which then creates the image to other services and other professionals that that's what we do, and it isn't. Social work is so much more, and I feel quite excited to be part of a group that is positive about bringing our identity back, because we are so much more than just doing care plans and things like that. And actually, I remember when I first started out in social work, a lot of my cases, I was the intervention. I was the service, and I know we have early intervention teams, or we're doing in my sector, and I think we need to grow that back. But I found today quite inspiring. So thank you.
Thank you.
Thank you, Janine. I would I know we're overrunning a little bit, but Jean, I would absolutely agree with you. And let's be absolutely clear. Care management is dead. It died when the Care Act came in for adults, and we have to, as social workers, embrace the principles of that. It's not perfect, but it's a hell of a lot better. And actually, we need to embrace that. So, you know, do go with it. And I do see some great social work being embedded across local authorities. Not everyone's there, but it's a journey we're on. So grasp it, Janine. Well, yeah, I agree with you.
Thank you once again, Mark and Fran, and thank you to all of you participating in this workshop. We really hope you enjoyed today's session. And I think, trying to say earlier, if you are a social worker, please also consider using this session maybe for CPD reflection. And I'm kind of squeezing that there in line with the professional standards, just because I know how busy everybody is. And thank you again. If you have further questions, we still have Fran and Mark in the session. But I can see some really amazing feedback coming through the chat. Oh, that's great. Yes. For Rachel, we have a channel, we have a YouTube channel under Social Work England, and we are going to post not just this workshop, but all the sessions where consent has been given to us. And the thinking behind that is because we want to make those available to all of those colleagues and people with the interest in social work sector who may be not able to join us this week. Please also consider if you want to share in your team meetings or with students and so on. Therefore, that's think around recording. And thank you, Mark and Fran, once again for agreeing for this session to be recorded. Thank you, everyone. We have now got 4 minutes over the allocated time, but I'm glad to still have you here with us. Right, and more comments coming in the chat.
It's lovely.
Right, Lisa, Matthew and Andrew, I hope you can add the correct chat link in the chat, please, for the YouTube. Lisa, bear with me. I will add it in a second.
Just to say, for if I will post both the videos on Twitter, I'm sure Fran will share them as well. So if you want to have a look at the videos and weren't able to, do jump on. It's going to look quite random on Twitter, just a video appearing, but yeah, follow our Twitter account and you can.
Thank you so much, and thanks for being a great great participators in giving us so many lovely comments and questions and things that we could bounce off of you for as well. That's really important. So thank you very much.
Thanks, everybody.
Thank you.